Almost invariably in association with the majority of injuries of the accessory ligament of the deep digital flexor tendon, there is palpable swelling. If you're new to the game, you may misinterpret this as being swelling involving the deep digital flexor tendon. But injuries to the deep digital flexor tendon are very rare in this location. Common things commonly occur, and it is highly likely to reflect enlargement of the accessory ligament of the deep digital flexor tendon. Typical ultrasonographic images are seen in to the right. Distension of the digital flexor tendon sheath is almost invariably of clinical significance when seen in forelimbs, particularly if unilateral, and usually reflects either primary tenosynovitis or synovitis secondary to a lesion of either the superficial or the deep digital flexor tendons. Bear in mind that the digital flexor tendon sheath is present not only proximal to the fetlock, but also distal to the fetlock in the pastern region. And therefore, when seeking the underlying cause, it is really important that a comprehensive ultrasonographic evaluation is performed, not only of the distal metacarpal region, but also of the fetlock and pastern regions as well. In the ultrasonographic images to the right, we see the typical appearance of a lateral margin tear, which extended longitudinally, involving the deep digital flexor tendon. This is the same horse as the limb specimen to the left. The large fluid-filled swelling seen on the palmarolateral aspect of this fetlock is a synoviocele. These may often be incidental, but they may be a cause of lameness, and this will depend on their size and whether or not there is excessive fluid creating tension and pressure. Their clinical significance can be determined by injecting local anesthetic solution into the synoviocele. The synovioceles, although adjacent to the fetlock joint, are usually associated with the digital flexor tendon sheath. Distension of the metacarpophalangeal joint capsule is often of clinical significance. Determine whether or not the swelling is confined to the palmar recess of the joint capsule or is also present dorsally. When assessing likely clinical significance, remember that the suspensory ligament branches are subsynovial in their location, and in association with injury, there may be distension of the palmar recess of the metacarpophalangeal joint capsule. Assessment of the digital pulse amplitude should be performed at the level of the proximal sesamoid bones and in the pastern region. In association with a subsolar abscess or acute laminitis, there is generally an increase in the digital pulse amplitudes. However, with chronic atypical laminitis, digital pulse amplitudes may be normal. It's also important to be aware that there are spontaneous fluctuations of temperature of the front feet and the distal aspects of the limbs, and this may be either bilateral or unilateral. And this is highlighted by the two images to the right. The image on the left is a thermographic image when effectively circulation to the distal aspect of the limb has been severely cut down on a temporary basis.